Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम DSSSB नर्सिंग ऑफिसर एग्जाम द 28 अगस्त 2019 शिफ्ट फर्स्ट का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। एक, a type of heat loss that occurs when the heat is removed by air current is known as A. Radiation, B. Conduction, C. Evaporation, D. Convection. Correct answer D. Convection. 2. The purine base found in RNA and DNA is A. Myoglobin, B. Adenine, C. Thymine, D. Uracil. Correct answer B. Adenine. 3. Ramu has a fever with 100 degrees Fahrenheit temperature. It rises to around 103 degrees Fahrenheit and comes down to 100 degrees Fahrenheit several times in a day in a typical pattern. What kind of fever is Ramu having? A. Constant, B. Intermittent, C. Remittent, D. Relapsing. Correct answer C. Remittent. 4. The temperature of a irrigating solution should be at what degrees in Fahrenheit? A. 9800, B. 120 104, C. 90 94, D. 110. Correct answer A. 9800. 5. Which of the following is not an example of dry heat application? A. Radiant warmer, B. Hot packs, C. Sun bath, D. Hot water bag. Correct answer B. Hot packs. 6. What is pectus excavatum deformity of chest? A. Narrowing of transverse diameter and depressed sternum. B. Ratio of anterior-posterior diameter to transverse diameter is 1:1. C. Depressed sternum and narrowing of anterior-posterior diameter. D. Protruding of sternum and an increased anterior-posterior diameter. Correct answer C. Depressed sternum and narrowing of anterior-posterior diameter. 7. Superficial ulceration of the skin, appearing as an abrasion and a blister is a characteristic of A. Stage 3 pressure ulcer, B. Stage 2 pressure ulcer, C. Stage 4 pressure ulcer, D. Stage 1 pressure ulcer. Correct answer B. Stage 2 pressure ulcer. 8. Bitot spots as a deficiency of A. Vitamin D, B. Vitamin B6, C. Vitamin K, D. Vitamin A. Correct answer D. Vitamin A. No. Which of the following is the correct statement with reference to learning by insight? A. Learning of active, voluntary behaviors are shaped by their consequence. B. Simplest learned activities are conditioned responses. C. Problem solving happens suddenly by understanding relationship between the parts of a problem. D. Learning occurs by trial and error or by direct experiences. Correct answer C. Problem solving happens suddenly by understanding relationship between the parts of a problem. Thus, which of the following actions show physical attending? A. Adopting an open posture. B. Maintain good eye contact. C. Leaning towards the person. D. Presume an understanding of client. Correct answer C. Leaning towards the person. 11. What is the mnemonic used for first aid of sprains? A. Rose. B. Push. C. Rice. D. Price. Correct answer C. Rice. 12. Keratin, the simple protein, is present in A. Nose. B. Eyes. C. Ligament. D. Nails. Correct answer D. Nails. 13. Identify an essential amino acid from the following. A. Glycine. B. Serine. C. Valine. D. Proline. Correct answer C. Valine. 14. Which of the following is not a host factor according to the agent-host environment model? A. Climate. B. Lifestyle. C. Age. D. Family history. Correct answer A. Climate. 15. Which of the following nursing intervention is not appropriate when an IV infusion infiltrates? A. Elevating the site. B. Applying warm, moist compress. C. Massaging or rubbing the site. D. Immediately stopping the infusion. Correct answer C. Massaging or rubbing the site. 16. Which of the following elements comes under secondary subjective data? A. The nurse palpates edema in lower extremity. B. The nurse measures weight. C. Client states severe pain while climbing. D. Spouse states the client has lost all appetite. Correct answer D. Spouse states the client has lost all appetite. 17. Identify an enzyme that is useful for digestion of fat. A. Lysine. B. Amylase. C. Resin. D. Lipase. Correct answer D. Lipase. 18. The heteropolysaccharide that acts as a lubricant and shock absorber in joints is A. Hyaluronic acid. B. Heparin. C. Cellulose. D. Glycogen. Correct answer A. Hyaluronic acid. 19. Which of the following options best suits for the meaning of a profession? A. Occupation with ethical component and intellectual study. B. Occupation with large number of personnel working. C. Occupation that promotes for higher study. D. Occupation with some practice. Correct answer A. Occupation with ethical component and intellectual study. B's. What is the meaning of PRN in medication administration? A. Immediately. B. When required. C. Alternate days. D. Every morning. Correct answer B. When required. 21. Which of the following signs, if noted, would be an early sign of excessive blood loss in a mother in immediate postpartum period? A. An increase in the pulse rate from 88 to 102 beats. B. Blood pressure changes from 130 by 88 to 124 by 80 millimeters of mercury. C. An increase in the respiratory rate from 18 to 22 breaths. D. A temperature of 100.4 degrees Fahrenheit. Correct answer A. An increase in the pulse rate from 88 to 102 beats. Bias. Which of the following noted on the assessment of a pregnant mother receiving magnesium sulfate for the management of preeclampsia determines that the client is experiencing toxicity? A. Respirations of 10 breaths. B. Serum magnesium level of 6 mg/L. C. Presence of deep tendon reflexes. D. Proteinuria of 3+. Correct answer A. Respirations of 10 breaths. 23. In which condition is the Crummer's rule used as clinical assessment method in neonates? A. Neonatal hyperbilirubinemia. B. Neonatal convulsions. C. Neonatal hypoglycemia. D. Neonatal hypothermia. Correct answer A. Neonatal hyperbilirubinemia. 24. Who developed the theory of psychosexual development? A. Lawrence Kohlberg. B. Jean Piaget. C. Eric H. Erikson. D. Sigmund Freud. Correct answer D. Sigmund Freud. 25. The severe type of vomiting during pregnancy which has deleterious effect on mother's health is called? A. Emesis gravidarum. B. Morning sickness. C. Chorea gravidarum. D. Hyperemesis gravidarum. Correct answer D. Hyperemesis gravidarum. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। And don't forget to subscribe. Thanks for watching. See you in next videos.